There's been a huge trend, obviously, the last couple of years with AI. The large language models are everywhere. We're hearing about it in the news and the press. One of the big challenges for AI right now is test cases where it actually does something to help people. Lots of hype, lots of interest, but we're excited because we've been testing some real cases of where we could use artificial intelligence to genuinely help improve something, in this case, healthcare. We've chosen to focus on delivery and administrative duties and some of the jobs that people really don't care for, particularly some of the lower pay, higher turnover type of jobs. I'm Mark Benden, School of Public Health, Department Head for Environmental and Occupational Health. Obviously, there's a lot of hype around clinical roles for AI, and this is exciting, but it's also very challenging. And the opportunity for doctors and nurses to be quickly replaced is, in my opinion, just not on the horizon. Supplemented, assisted, another tool for them. However, on the administrative side, there's lots of duties, typically 3 or 4 people in a clinic and 5 to 7 people in a hospital for every doctor and nurse that need help. And we typically have shortages of them. We don't have enough folks on staff. This causes disruptions. It causes all of us to have to wait longer to see our physician, to see our nurse. So we're excited about the opportunity to bring something that can help on that administrative side, reduce the total number of people that we need to get folks seen by clinicians. And we think that this is a really good role for AI. So as you can imagine, with the advent of electronic medical records, which are required across the United States now, there's been lots of concerns ever since that happened years ago. What's going on with my data? How's my privacy? Will artificial intelligence enhance that, change that? Will I be at greater risk, less risk? Our belief right now is that artificial intelligence is probably the best shot we've got at helping to minimize risk. And the reason for that is that it does things so much quicker and faster and more efficiently than humans do. We believe that there's going to be some better firewalls and safeguards put up as a result of using this type of technology rather than putting us at greater risk. Again, we really believe that AI is a way to supplement human activity, human work. We see it as another tool for people to use, but probably more importantly, folks ask the question of me often, hey, is this going to take my job? I do believe there will be certain activities, certain tasks, certain things that happen today through human hands that will occur and be done automatically through artificial intelligence. If you go back, when I was a child, there was a big debate in the schools about whether we should be allowed to use a calculator, right? A handheld calculator in the classroom. So I kind of lived through that fight between the teachers and the administration and the parents and the children. And eventually, as you know, calculators became very commonplace and we all use them. This is what's going to happen with AI. It's going to get to the point where we will just all utilize these tools. We will all become more efficient. We will get more things done. It will help us. In healthcare, it's actually the most troublesome of all industries as far as getting through on a phone call. So about 1 out of 3 phone calls to healthcare reaches the person that you were trying to get to. Typically, you get some sort of an answering service or a system, especially if it's after hours. Artificial intelligence and digital humans offer, I think, patients, more importantly, all of us, the opportunity to have 24/7 access to a person-like figure that we can have a conversation with. That conversational AI becomes really important because it enhances our experience, but it may also answer our questions. Now, they're not going to be able to help you like a doctor or nurse would, but they may be able to help get you the assistance that you need and get you that assistance when you need it. We're at an age where artificial intelligence is starting to lean closer and closer towards this type of agentic AI. The big difference with agentic AI is that it's not just answering a question. So go out to the internet, find me an answer to a question. Who was the 23rd president? Google can do that. Large language models can do that. What agentic AI can do is it can say, hey, I saw that you are talking and asking these types of questions. Would you like me to complete that process for you? So imagine you call your healthcare provider and you say, hey, I got all these forms they're telling me I need to fill out. The AI can say, yes, I've completed them all for you. Would you like me to submit them? That's different than, here's an email of the form, fill it out yourself and bring it to the office. So just again, improving the efficiency, improving the throughput, taking action and doing things to help people. It's going to be a game changer for us all.
Question, are you satisfied with your visit today? Once you've answered, press next to continue. How likely are you that best matches how you feel? When you're ready, say or press next to move on. Improve your care or experience in the future. Please answer the best you can, and then press next when you're ready. That's it. Are you satisfied with your visit today? Once you've answered, press next to continue. How likely are you to wreck your experience, better or worse? When you're done, say or press next to move on.
Maybe she
And
might.
finally, how can we improve your care or experience in the future?
There, you might be able to
Please
say
answer
something.
the best you can, and then press next when you're ready.
Jelajahi cara baru mendapatkan informasi. Download MetroTV Extend sekarang.